What's up, you guys? It's your boy Miguel, giving you your daily dose of radiation. Today's video, we're covering how to work smarter, not harder, in the ER as an X-ray tech. So to give you some context, I am a night shift X-ray tech, work 7 on, 7 off, work a lot of day shift because I do overtime. So some of the things I learned, not as a student, but once as I was a tech and I started to pay attention to things. So every patient that comes in, let's say your usual bread and butter, chest pain, shortness of breath, like just those two alone make up like 80% of our job as X-ray techs. I've noticed quickly that there's a certain like routine stuff that happens. Like the patient will come, both from being from the patient side and from just observing as a student. When the patient comes in, they get checked in, the nurse sits them down, hooks them up to the EKG, does the EKG, goes through basic vital signs. Usually they'll swab them for COVID, swab them and all that, and then they'll get an IV, and they'll like do maybe blood cultures or other things. Like there's a set amount of little things that they do, just as a basic standard protocol for almost everyone. And if you're doing X-ray, just doing a chest X-ray, and they just barely got there, usually anyone who's 10 minutes and under, for you as an X-ray tech to either get that picture done, you either have to be there as soon as they came in, when the nurse is getting out, to go maybe get some swabs, to get some other stuff, you can snag it there. Or if registration's in there, you can either go after them. But besides that, the nurse majority of the time will be in there. So if you work nighttime like I do, and there's less of you, instead of constantly doing rounds and rounds, you could go in the patient's chart and you could look and see if they've been swabbed, if they had their blood work, all this other stuff like that, and like pregnancy tests and stuff like that, to save you become a more optimal round. Because ain't nothing pisses us off that we'll go around, do a little round of like 5 X-rays we have to do, and we can't get none of them because the nurse is in there. And you're like, well, I could have just waited, or I could have went to the floor, could have done something else, right? So that's what me and my partner do. We'll like observe and make sure everyone, like if there's like a lot of X-rays, then we'll just still go ahead, and even if they haven't got, like, see if we can squeeze it in. Because certain nurses, more on night shifts, are more, they like will let you squeeze in, get your picture, because they know if it's a chest X-ray, 30 seconds in and out, then they don't got to worry about you no more. Versus other departments at night, a little different. Especially if the doctor's in there, you know you're golden. Especially after they're done giving their little spiel, they could do it. Or some doctors, because they want to know what's going on with their patients, they'll let you right away get the picture. So that, that's nice. At daytime is a little bit different because they don't. They're like, they take their time. They won't let you like squeeze in real quick and like get the picture and stuff like that. And it's just a little bit different during the daytime. Or even if respiratory's in there, we're good buddies too, because they want to know what the lung looks like. So they could maybe, if like they see something on the X-rays, they can maybe know what they have to prepare for. So sometimes they'll let you shoot it and they'll just look and then just keep it pushing, which is nice, And yeah, it's been your one, Miguel. See you on the next one.